Other questions?
You had said that you get minerals and where you form, I'm trying to think what you said.
Yes.
You know what I'm talking
Yes.
about? Can that ever go away?
Great question. Okay. This here, because the most common form of arthritis is the kind that's acquired and is referred to as degenerative or osteo, they've made a model. So, this is a nice healthy joint of the spine. As it degenerates and you lose its integrity, you lose fluid, and the outside tissue begins to harden, you start to lose space. And then now this is considered unstable and has a lot of stress on it. So the body says, since your own body can't maintain its health, I'm going to begin to fuse this together because I don't want it to fall apart. And it begins to extract minerals and elements out of the blood and deposits them around this joint. And then over time, now arthritis forms in stages. It's not one day you have it, one day you don't. What happens is it starts off like a paste, like toothpaste. And then it starts to harden, and then it begins to crystallize. And once it begins to crystallize, that's when you see it on an x-ray film. And so if you see arthritis on an x-ray film and a doctor says to you, well, it's pretty mild, there's not a lot there. What they really should be saying is there's not a lot there that you can see. Because x-rays will penetrate through soft tissue, and there's a lot of stuff here that's still soft, and you can't see it on an x-ray film. I'm in my 30s, and there are times that I wake up and I'm stiff, and I have x-rays of my spine, and it doesn't show arthritis, but I know that I've got it already. It's just not showing up. Now, you asked what can we do to take it away, or can it be taken away? And the answer is yes, as long as it hasn't crystallized yet. You know, remember I said that there is a reflex response that creates the body to stimulate that production of minerals? Well, you can reverse that and go from a positive charge to a negative charge. And then the body begins to reabsorb that. How do we know that's true? Anybody know of someone that has ever had a calcaneal spur on their foot? Yes. And has anybody ever done physical therapy or worn a big boot? Yeah, and did it work for you?
It helped to immobilize, yeah.
Yes, it did. And the reason it helped is because it took the stress off the Achilles tendon and off the bottom of the foot, the plantar fascia. And that relaxed that tendon. And so one day you saw a little bit of arthritis on the film, and the next time a lot of it was reabsorbed back into the body. But it took time to have that. Now, it's not real practical or appropriate to immobilize the torso and the spine. There are a lot of other consequences that are worse off for doing that to a patient. But what you can do is you can practice passive assisted, which is stretching and chiropractic manipulation. The passive range of motion, which is stretching on your own without help. To active range of motion, which is things like walking and swimming, to resistive ranges of motion, which is using weights and pulling bands and doing some physical labor. And they're all controlled ranges of motion. And doing that tells the joint, I can move, I can do it myself, I'm strong enough, don't fuse me. And so the old saying, keep moving it or you're going to lose it, there's a lot of truth to that. Does that help answer the question?
Yes, it does.
Great.
Now, I have a question about, exercise. Because I don't get any specific, clear exercises that are appropriate. I just have this vague thing about you should be exercising, So it's like, where do I find appropriate exercises for back health in general?
For example, in my office, I have a program. I'm passionate about exercise because while I was studying at the university, I was in physical therapy. And so that's a very important part of the practice. And I have a program that I print off for patients, and they're very specific exercises that I teach them, and then I give them photos, and I say, here you go, this is how you do it. And you can get that at many chiropractic offices, or especially in a physical therapy clinic, and they can teach you those things. Many times medical physicians don't understand it or know it as well as a chiropractor or physical therapist, simply because that's not what they do. Their job is to prescribe medicine. And when you're away from anything for a long time, you tend to forget it a little bit. So that is important, because you could be doing the wrong thing and actually hurting yourself. And if you've ever had a problem and have been referred to physical therapy, and you've gone to physical therapy and it didn't work, or it hurt more or made you worse, here's the reason why. Because they were trying to make an unhealthy joint strong. You have to start at the joint and make the joint healthy, and then you take a healthy joint and make it strong. That makes so much more sense, and it helps 100% of the time when you work at it that way. Great? Yes?
Most of the time when I've seen a chiropractor, they deal strictly with my spine. But I have arthritis in my hands and arthritis in my knee, and that never gets addressed. Are there things that you can do chiropractically for each one of the joints, just as opposed to the spine?
Yes. Just like you have a gastroenterologist or a neurologist or any other different field, there are fields within the chiropractic profession. And every joint should be addressed. The TMJ, the shoulder, the elbow, the wrists, they work very differently. They carry a different amount of weight. And so they're usually treated very quickly and efficiently, as opposed to the spine that carries your torso and your weight, and that takes a lot longer, and it's harder to get to versus the wrist, which is very easy. And so yes, there are techniques that can be used to address those, which again, we often do in our office. If it's not being addressed, it's because of one or two things. Remember, the peripheral nervous system goes from the spine to the periphery. And so your professional may think that, in his or her opinion, that the reason you're having symptoms here is because it's coming from here, and so they're working on the origin. Or that's not within their scope of practice or technique. And so you need to look in a different place for it.
Could you give us your opinion on massage therapy?
Oh, yes. Massage therapy. So here's my background in where I practice. We have acupuncture in the office. We have massage therapists in the office. Physical therapy, chiropractic, and nutritional counsel. Massage therapy is extremely powerful. It's more than going to a salon for relaxation, although there's a lot behind that. Massage therapy can be used to treat bursitis. It can be used to treat arthritic hands and knees. I can't tell you how many knees we've treated through massage. I'm working on my own father at the moment for painful knees due to arthritis. You know, when you have arthritis and it hurts, what's the first thing you do? You avoid using the joint as much. And then you start compensating and you might limp. And now you're stressing out muscles and ligament tissue. And massage therapy is extremely effective at increasing blood flow and improving range of motion and reducing pain. Actually, there was a documentary on I think it was Discovery Channel or one of those things on TV not too long ago, where there was a man who was extremely overweight and had developed a terrible tumor. And you know, Western medicine said, let's cut it out. And it was like a 52-pound tumor. And what happened was he was so overweight that it clogged his lymphatic system, and all of his lymph nodes inside of his thigh just swelled up. They couldn't drain. And so this gentleman was from Mexico. And so massage therapy is very prominent there, as it is in most Central and South American countries. And so they worked on him for weeks, aggressively, multiple therapists at a time. And they reduced it by something like 70%. And now they had this tumor under control, and it was this big instead of this big. And then they were able to do surgical procedures on it, which significantly reduced his risk factors. Massage therapy is extremely beneficial in patients that are stiff and having pain through osteoporosis. When it's severe enough that I cannot perform manipulation, I provide a prescription of acupuncture and massage therapy that's very helpful. So I love massage. It's very therapeutic. And oftentimes, by the way, many people don't know this, their health insurance will pay for their massage treatments when it's prescribed by their chiropractor or primary care physician. So you gotta look at your insurance benefits too. These are all really great questions. And again, if you have any reservations for asking some of the ones that are really important to you, you can talk to George. George will help you out in the back. Feel free to email me. George can provide you with my email address too, and I'm always checking that, and I'm always answering those questions there as well. Look at our website online. George will provide you with information with that too. It's myclevelandchiropractor.com, and at myclevelandchiropractor.com you can just search through the website. You'll get lots of information, and you have access to talk to me through there as well. There's also a link. I have done 17 or 18 lectures at a television studio that you've been able to access and put online. And they have different topics from working with kids to fibromyalgia to actually witnessing how manipulation works to some basic exercises that I teach. And it's very useful. So use those tools. They're all free. They're online. And so use that. Thank you so much for inviting me here. I really thank you for your attention. And